Thanks for giving this opportunity to speak about a very important issue, the collaboration between the international organization and labs to strengthen animal health system and food security. As such, we are, with a heartfelt gratitude, thanks also the organizers. And I'm honored to line up here with the excellent lineup of experts who will share their vision and perspectives and also their expertise. Indeed, FAO and WOAH reference labs and collaborating centers are internationally recognized institutions that used to provide capacity building, provide also, research work, and also build capacity for the professional staffs, and also share governments and other organizations their development plans. They play a vital role in translating science and science policies into the real life. And also, for me, from WOAH has more than 300 collaborating centers and reference lab who are working in different specialty, reference lab working for specific diseases, and collaborating centers providing technical advices and technical support for countries in horizontal issues like animal welfare, like epidemiology, risk analysis, and so forth. I'm pleased to have with me today Mr. Asma Abdi Shah. She is the head of the WOAH Collaborating Center for Quality Management and also head of the WOAH Collaborating Center for the Camel diseases. And also, she is the head of the reference lab for the COVID-19 in the UAE. And also, my colleague, Markos Tibbo, is the senior livestock expert and officer in the FAO Subregional Office in the, for the GCC and Yemen. And also, our expert, Bernard Faye, the Emeritus Scientist from CIRAD, and now is the International Cooperation Center in the agronomic research in France, an international camel expert, a well-known and renowned camel expert, and also our colleague, Dr. Sophie Von Dobschütz. She's a team leader of global COVID-19 and other coronavirus program. We are starting with our colleague, Dr. Asma, about their experience. They have an inspiring experience in collaboration with the other governments, like Ethiopian government, in strengthening their programs of camel diseases. And it was really an inspiring and productive experience that deserves to shed light upon it. Sir Asma, the floor is yours to start with your experience with the Ethiopian entities. Because, it is a very shining example for the cooperation between collaborating centers and also from the other authorities in developing countries. The floor is yours.
Yeah, thank you, Doctor. International collaboration between collaborating center and reference laboratories is very crucial and important to improve the livestock health on the global scale. And one of the main role and objective of any collaborating center or reference laboratory is recognized by any international organization like World Organization of Animal Health or WHO or FAO is to strengthen the collaboration and connection with different laboratories which can support exchanging knowledge, information, and enhancing the global animal health. As a key example, I would like to highlight our participation in a joint investigation with our partners in Ethiopia. As a collaborating center on camel disease and quality management, we received official letter from the Ministry of Agriculture in Ethiopia to support them in the investigation of unknown camel death. And as a collaborating center of camel disease, we formed a team, and our technical team, they supported in the field, parallel with or in collaboration with the Ethiopian Institute. And the successful collaboration between both parties helped us to identify one of the main causes of the unknown camel diseases there, which came out with the detection of fossils brawn, which identified for the first time in our laboratories. Field investigation conducted successfully, samples transferred between both laboratories in the different region, and a scientific publication published. According to this journey, it's a journey of successful collaboration between different laboratories or collaborating centers from different regions, which allow us as a collaborating center for camel disease to understand more the epidemiology of different camel diseases, not only in our region, in other regions. And this is basically one of the objectives of our center, or of the international centers and the reference laboratories, to enhance the connection with the different laboratories, exchanging knowledge, information, strategies, protocols, which will enhance and reflect on the national level and international level as well.
Yes. Thanks, Asma, for focusing light on this very successful experience. And really, it is maybe a good example to be invested in the future in other countries, in other fragile countries. Now I move to my colleague, Dr. Markos. Dr. Markos, FAO has a long history of establishing collaborating center and reference scientific reference centers to provide also expertise and support, technical support for countries, particularly the fragile and less developed countries, and also it leads how can the collaboration between the South-South and the Triangle Cooperation affect and push forward this important collaboration at the regional and at the global level, and also at the country levels. How can we benefit from this concept?
Okay, thank you very much. FAO, Food and Agriculture Organization of the United Nations, plays a central role for collaboration and partnerships for improving animal health and food security, as well as One Health. And FAO plays a critical role as it designates reference centers. Actually, it is the Director General of FAO who will designate a center based on established criteria. And by doing so, we facilitate this network of reference centers to support countries through technical assistance and also knowledge exchange, and also through South-South cooperation. For example, the South-South cooperation that we use to support countries is to support countries that are well advanced, to use the countries that are well advanced with the reference centers that we have already designated, and with a country that requires that type of support, and also that country also collaborating with another country to pass on to that knowledge to another. For example, let me give you one example. One example that I can give you is Pakistan. In 2023, FAO, in collaboration with CIRAD, which is a French institution, which is FAO's reference center, supported Pakistan to produce its own quality vaccine for a disease called peste des petits ruminants, which affects small ruminants, sheep and goats. And this center, based in France, passed on to the seeds and also cell lines that help them to produce vaccine by themselves. And this arrangement actually helped Pakistan to produce quality vaccines that is actually helping to eradicate PPR by 2028. And accordingly, Pakistan also passed on to this knowledge to Sudan, and they have collaborated well. And in fact, we are now planning to vaccinate more than 9 million animals in Sudan from the South-South cooperation or triangular cooperation that we have supported with. And this is just to give you one example. And therefore, our help support countries to translate science into policy, and also this policy also into action by this practice already changing, the food security and also saving lives and livelihoods. Thank you.
Thanks, Markos, for highlighting this issue. It's important. This collaboration could support developing countries, and particularly the countries which is in a very huge need to these efforts. And now the floor is for our Camel expert, Dr. Bernard Faye. He's a well-known and renowned scientist in Camel. And he has a lot of published works and a lot of contribution throughout his works with CIRAD and also with other governments in the region. Dr. Bernard, how this international collaboration between these centers, how did it improve our understanding to the camel diseases, in the epidemiology, in the pathogenesis, and in designing a very strong strategies to confront these diseases? Camel population, many countries suffer from trypanosoma and from brucellosis, and later, although meals coffee is not a clinical disease in camel, but it affects human, and this all which paves the way for the One Health cooperation between animal health and public health authorities. The floor is yours.
Thank you. I just want to introduce, because it's important for international collaboration, what is CIRAD?
Yes.
Because maybe some people, they don't know what is CIRAD. CIRAD is a French research institute. It's not international institute. It's a French institute. But in the title, in French, translated in English, it is a Center of International Cooperation for Agronomic Research in Development. So it means in the title of this institute, you have already international cooperation. Historically, it is an institute which is gather all the technical institute during the colonial time of French government. And after the independence of most of the country in Africa, these technical institutes were all gathered in one institute, we call it CIRAD. And all the scientists working, it is 800 scientists and 800 people working in this institute. It's not a small institute, it's a big institute. And all the scientists inside never work alone and never work in France. You know, I'm Camel expert, and I spent 5 years in Saudi Arabia, and so people, they ask me, how is possible a French guy is a Camel expert? It's because I spent my life out of France. I spent my life in Ethiopia, in Niger, in Saudi Arabia, where I study in partnership on the camel. So, I mean the international cooperation is in our gene, right? In our ADN as a scientist. We never work together. And myself, I have for a long time collaboration with the University of Emirates here in Abu Dhabi and Al-Ain. So we are accustomed to have a collaboration. And within this institute, we have one topic, which is animal health in tropical countries. And we developed for a long time collaboration. We are actually, we have two laboratories of reference laboratory, one for the Rift Valley fever and one for PPR. And we have a strong experience on trypanosoma to speak about camel. And actually, we have also international project on the sudden death in camel in the Horn of Africa. You know, since now 20, 30 years, we have some outbreak, especially in the Somalia, Ethiopia, Sudan, and Kenya, sudden death of the camel. And we don't know, and we have a big project to make the diagnosis of this sudden death. Why? Because it is important in terms of prevalence and why there is a lot of deaths of this camel in this area. And that is an international collaboration project. And it is important for, I think, for Camelet, because you know the exchange between the Horn of Africa and the Arabian Peninsula regarding the camel export. And for trans-frontier disease, it is an important element to know what is the diagnosis of this disease to avoid any importation in Arabian Peninsula. So I think the collaboration, it is must be important if it is within a project, with a different partner, and we're accustomed at CIRAD to work in partnership with many, many countries.
Thanks, Bernard. Really, it is very significant insights. Sorry. Thanks for your significant insights. Now I move to our colleague, Sophie. Sophie, we would like to be told about the expansion of the influenza AI SRS, and to include the MERS-CoV and SARS-CoV-2. What is the horizon for the development of the work under this new umbrella? And what do you expect that this collaboration and inclusion of this animal disease would bring at the One Health level for collaboration and information exchange between laboratories, and also so as to cover the knowledge and research gaps that still creating problem about the transmission mechanism of the MERS-CoV and the role of other species than camel in transmission, and also the molecular characterization of different chelates. The floor is yours. Thank you.
Thank you so much. So it's my pleasure to be here, and I'm working for WHO's Epidemic and Pandemic Management Department. This is where our work on respiratory pathogens is located, and indeed I'm taking you into the One Health space, recognizing that the health of animals, the environment, and humans is deeply connected, and we have to work together in order to make progress in fighting not only animal but also human diseases. And there are indeed two examples I would like to share with you. So one is on WHO's Global Influenza Surveillance and Response System, GISRIS, which actually exists for over 50 years. And as the name says, so it started with the urge to develop a system for early detection of influenza viruses in human populations. And so it connects the influenza centers or national influenza centers in the different countries together, and they share the results that they generate. And they also share these results publicly so that the vaccine-producing companies can take the information of circulating viruses and produce the right vaccines that protect the populations against circulating viruses. And so this has actually over the years established into a self-funded mechanism in that sense that the GISRIS laboratories generate and provide the information that the vaccine companies need, and in turn they will provide money for capacity building projects on epidemic and pandemic preparedness, which in turn strengthens the GISRIS systems because it goes back to the countries that produce these results. And I thought to share this as a very important public-private partnership mechanism that actually has been successful for all these years and continues to be successful. So where does animal health come in? Indeed, this is only one side of the medal. Then we have our colleagues from FAO and WOAH who in, I think, 2005 or something, created the OFLU, the OIE, and because WOAH was called OIE at the time, the OIE and FAO network of expertise for animal influenzas. And recognizing that animal influenzas can spill over and infect humans, as we've seen, we still see sporadically, and we've seen with the latest H5N1 virus that was circulating or is still circulating in Northern America. And we had other cases from poultry in Asia. And so FAO and OIE bring together their network of reference laboratories to generate information on circulating animal viruses. And that, of course, is important to include in the discussions on what to put into vaccines for humans, because if we have a situation where an animal virus is widely circulating and can infect humans, then of course there need to be considerations if or not to include this in the human vaccine package. So there's a very, very close collaboration between the three organizations and their respective networks. And the other example I wanted to give indeed starts with MERS coronavirus. So as you know, the virus emerged in 2012. And since then, again, WHO together with FAO and WOAH has worked on finding solutions to combat the virus, how to treat it in humans, how to prevent spillovers from animals. And so a huge network of laboratories and other research institutions was created back then. And when the COVID-19 pandemic happened upon us, these were the experts, this was the network that was quickly brought together in order to discuss this new coronavirus that just emerged, and we knew so little about it at the beginning. And these experts were the ones creating very, very rapidly diagnostic protocols that were then used by Germany, by Charité in Germany, to generate diagnostics to actually detect the virus. And these were shared rapidly with the help of WHO in all the world, and were available as early as end January, early February in 2020, so when the virus just had emerged in China. And so this network actually helped to hit the ground running when we were facing a pandemic. And because the network was so important, WHO then decided to institutionalize it to what we now call COVINET, and bring these networks together, and we have since expanded. We now have 48 laboratories and institutions actually coming together under the network. ADAFSA is one of them. And 4 of these 48 deal with animal diseases and animal viruses, and other 2 with environmental or wastewater surveillance. And so this is a rich, very rich network of expertise that we can draw upon whenever we want to have information early and accurate and timely that can be shared with the international community for risk assessments, and to develop the right diagnostics that actually, for example, still are able to detect the currently circulating SARS-CoV-2 strains, and also therapeutics and vaccines.
Thanks a lot, Sophie. It's a very fruitful and very completed report about the achievements. And tell us about your expectation in the next 5 years. So what do you expect according to the emerging challenges in this regarding coronaviruses, which is already diagnosed, or the novel viruses in heightening the preparedness against the coming pandemic or endemics?
Thank you. Yeah, indeed. So, I mean, the challenge coming from influenza and coronaviruses will unfortunately never go away. As you know, they are widely circulating in human but also animal populations, and so we are always faced with the threat of a new virus emerging to which the human population doesn't have any immune response ready, so that it could cause an epidemic or a pandemic. Here these networks, they play important roles because first of all, by bringing together the laboratories and research institutions that actually do the surveillance in country on the ground, there are eyes and ears on the ground in order to pick up any novel emerging either strain or maybe completely new virus that we need to consider and be prepared for. So it's the early detection and the early warning that these networks help to keep up. But then again, by producing genetic information, for example, of these circulating viruses, and maybe this is a call out to anyone working in research. So actually since 2022, the amount of genetic sequences that have been shared for SARS-CoV-2 or MERS have drastically reduced, and so we actually face difficulties in conducting appropriate risk assessment. So it's really, really important to share these findings so that the global organizations have a good understanding of what is circulating in the world in order to be better prepared and to safeguard our community health. And then again, for producing vaccines, this is an important information that's been generated by these laboratories. And by leveraging, so when putting together all these laboratories and research institutions into one big network, we of course have laboratories that are well equipped and well funded and sort of in the higher income countries, and then we might have laboratories which have challenges to get appropriate funding, and they have challenges and they are actually reliant on capacity building infusions. And so by bringing all these different labs together, we can create exchanges where the capacity building is actually done within the network by the higher income labs supporting the lower income labs, and this is also something that works very, very nicely and has been shown in COVINET as well.
Thanks, Sophie. We are moving back to Asma. Asma, we are speaking. Moving back to Asma, we are speaking about the future. You know, what is the critical success factors that you would like to be at your control in the projects to come to support this, to enhance this collaboration between your collaborating center and other countries? How do you look at the future for your?
Yes.
In addition to of course, the political will and political support, and you have.
Enhancing the connection between, or strengthen the connection between laboratories will definitely impact the global animal health, as I said in the beginning. But again, another example I would like to highlight is Camel. It's a well-established platform in the region dedicated for the camel diseases. It's Camel Middle East network with a membership of 9 countries, Gulf countries, plus Jordan, Yemen, and Iraq. And the main objective of the network is to facilitate the collaboration between the member countries and the international organization, enhancing the camel health and improving the diagnostic techniques of the detection of the camel health, and improving also the quality of the testing approaches, increasing the research and the scientific collaboration between the member countries. And it is set as a model today, the CAMELnet. More than 500 trainees, we deliver the training because we do believe that building capacity building by focusing on the human resources is very important for us. So training in different fields delivered through the platform. We developed and the first diagnostic kit, parasitology kit, It's an educational kit from the field actual cases, which can be used by universities as a reference kit or any laboratories. Tomorrow we have the steering committee meeting for the cabinet steering committee and the technical committee to discuss the movement of the camel between the countries, which is a very important issue for the region. So cabinet is also a good example of the platform.
Thanks, Asma. It is really very optimistic and very inspiring way of thinking, and we look forward for the future achievement. And now our colleague Markos, we need to elaborate about the FAO experience of lesson learned from PPR eradication and antimicrobial resistance surveillance. How could lesson learned from this pride of this outstanding experiences to inform the international collaboration and to improve it or to enhance it?
Yeah, as I already mentioned, South-South cooperation is a triangular cooperation that actually have a powerful tool that can support countries. And the example that I have presented is one example of the many. By the way, FAO has over 70 reference centers, and collaboration through the whether it is through the twinning program, through the peer-to-peer learning process, and also like regional networks of laboratories that can actually strengthen the capacity in terms of diagnostics, in terms of laboratory surveillance capacity. This type of South-South cooperation and also regional cooperation can enhance the capacity of countries and reference centers and also collaborating centers. By the way, we collaborate very closely with World Organization for Animal Health because sometimes we have even one reference center and collaborating center for both of the institution. And by creating this type of arrangements to support member countries, the countries benefit a lot from the twinning programs that we support. Therefore, I think by doing so, we can ensure that our animals are healthy and the food systems that we rely on are also safe, and that we protect our animals and also we protect our health as well. And therefore, it's a very strong system that is already established and which we have to benefit also for this region. And if I had the chance, I would have presented where these reference centers and collaborating centers are located. And we don't have really much in our region, in the Middle East region. Therefore, we really want to have more of the centers and the collaborating centers in the region. And we really encourage laboratories to apply. There is a procedure online that you can refer to. In FAO, we have a clear guidelines on how to apply to get those kind of recognition and designation. Thank you.
Thanks, Markos. And before opening the floor for the audience, I will, last but not least, I will ask our expert, Camel expert, Faye, about the position of camel farming in the agenda of the collaboration between collaboration of the collaborating centers themselves, how to advance this, and what is the opportunity for the cabinet to push this forward in order to exploit the productive potential in camels as a support for food security. How do you see the opportunity in that?
Okay, I think one element which is very important, that we have to to the mind that the camel is a very mobile animal. And especially, there is a very important movement of live animal between Horn of Africa and Arabian Peninsula, but also from Western Africa to the North Africa. And now from the West Africa to the coastal countries. And we can see now exportation to Côte d'Ivoire, Ghana, Nigeria, for example. So there is important movement, and if there is movement, there is also movement of the disease and the risk of disease. So I think it is important for the collaboration to develop collaboration out of the MENA and to have collaboration with African countries, especially in the Horn of Africa, Kenya, Ethiopia, Sudan, when the peace will come back, or Egypt also. And, you know, also in West Africa, the most important country for camel population in the world is Chad. 25% of the camel population in the world is from Chad. If you had all the Saharan countries, you have more than 40% of the camel population. And if you had the Horn of Africa, you have almost 80% of the camel population in the world. So the collaboration must be developed with all the laboratories in this area. They are not necessarily specialized in camel disease, but they have some expertise in animal disease. So I think we have to develop contact and collaboration with this center. For me, it's fundamental for the security in Arabian Peninsula.
Thanks a lot, Bernard. And the floor is open for our audience if somebody have burning questions for our experts.
So the first question is to Dr. Bernard and Asma Abdi. So both of you represent the Collaborating Centre and Reference Centre. So usually what are the major obstacles usually faced when you establish international collaboration? Usually the international collaboration is not easy to establish. So what are the major obstacles you face? The second question goes to Dr. Markos and Dr. Sophie. Both of you represent like an international organization. If you had to rate the international collaboration that currently exists around the world, does it really satisfy the need of international? Is it clear, my voice or not?
Yes, it's clear, I think, for our experts. You can provide quick answers.
What was the first question?
The question is...
Dr. Bernard, you can answer. I didn't get it. Yeah.
There is echo.
Can you summarize the question, the first question, in one word or two words?
Yes.
Yeah.
The first question is for the Collaborating Centre. Establishing an international collaboration is a critical cornerstone to ensure the health of livestock.
Yes.
What are the major obstacles usually faced when you establish international collaboration between the reference centre?
Okay.
Yes,
good.
it is now clear about the main challenges. You know.
I think the major challenge in the obstacle or the challenge regarding the collaboration between centers. This is the question. Okay, I think still the collaboration, so many issues, definitely collaborating with the centers or reference laboratories in the region will be easier than to collaborate with other regions. But still, we are getting together by, I think, the networking like COVINet or other CAMELnet, it's improving and the connection between laboratories. But to go and search, and definitely the research opportunities between countries and reference laboratories can also improve the connection and collaboration between centers, expertise and exchanging knowledge and expertise between laboratories. All these things facilitate the connection and improving it, but still, again, yes, the challenge is there. I don't know if Dr. Bernard would like to add something?
Would you like to add something, Dr. Bernard, for the challenges that can, obstacles that can impede this international collaboration between centers and in addition to the sometimes the countries face some, resource problems. Sometimes, there is a political instability. In some countries, it is varied between countries. Some countries, there is unwilling to collaborate. Anyway, we have run out of time, and thank you, Mohammed, for the question, and I will give the floor for Markos for last.
Allow me to give you some briefs on the challenges, but the challenges can be converted into opportunities. I think for the center to be to have like this status of reference center, there has to be a precursor collaboration so that the center has delivered already something useful that should be recognized. It's also part, like the designation is also recognition of the work already done. Therefore, FAO demands, for example, the laboratory has already collaborated with FAO in a significant way, in a substantive way. And also that there is a measure of scientific and technical standing of the laboratory. And the committee will assess the laboratory, whether it has demonstrated expertise to do that specific work, because the reference center is not designated simply for general things, to specific diseases. Therefore, in that specific disease, that laboratory should have already demonstrated through either through publications or some visible demonstrated evidence that can be shown. And there are a number of things. I mean, there are like 9 criteria that are listed, which I cannot summarize it now, but there are a number of things, but there has to be precursor collaboration to get recognized. Thank you.
Thanks, Markos. In half a minute, last word for
very short.
Sophie.
Yeah, thank you. You're bringing up an important point. I think technically, if we have technical experts from different countries collaborating, they always see the higher goal, the science, and they work together very, very nicely because they know they can share expertise and they both gain from it, or everyone gains from it. Obviously, FAO and WHO have an important role to play to provide a neutral forum. And when bringing countries together, they should ideally leave political considerations behind and just work on the scientific question in front of them. And I think one very, very powerful example was the recent adoption of the pandemic agreement at the World Health Assembly in May earlier this year. To be honest, many thought it's not going to happen, we won't have enough countries really signing up for it. In the end, it happened, and that just shows that we're still working together. Thank you.
Thanks, Sophie. At last, I would like to thank our experts for their insightful contributions and also for the thought-provoking ideas they presented. And also thanks the audience and Dr. Mohamed for their positive interaction. With this, we end our session, and thanks you all.